Welcome back. So now I'm going to introduce to you Neomi.
Hello.
Surname?
Bennett.
Bennett, yep, because the thing the autocue wasn't up. Sorry, guys. Neomi Bennett, everybody. How are you, my love?
I'm very well, thank you.
So it's good to have you here because you're going to talk to us about something very, very important, which is deep vein thrombosis, and also telling us about a product that you designed to help with that. So first of all, for the viewers that don't know, what is DVT?
DVT stands for deep vein thrombosis, and that's a blood clot which can develop in the deep veins of a person's legs.
Mm-hmm. And how does it develop?
How does it develop? Your heart works in two, and the heart first beat pushes the blood down to your toes, and then in your calves you've got something called a peripheral heart, which is the second part of your heart, and it helps to bring the blood back up to your circulation.
Okay. Now let me just explain to the viewers that Neomi is also a nurse.
Right, so you're a nurse practitioner.
So you know she does know what she's talking about here. So basically, when that happens, what damage does it do to you?
It can cause a clot. It can cause a clot, and the clot can come away from the deep veins and make its way to your brain or to your lungs, and it's fatal. It can cause death. At the moment, in the UK, 25,000 people are dying of deep vein thrombosis.
Wow. That's a big number, isn't it?
Definitely.
Okay then. Now obviously we hear, like, you know, sort of health news and stuff like that about doing your exercises when you're on long haul flights and sort of moving around and stuff like that. But they also introduced those quite tight socks.
Yeah, absolutely.
So what do you think of those?
Yeah, basically NeoSlip has been designed to help put the stockings on. The stockings work by putting pressure onto that peripheral heart.
Okay.
To keep the blood moving, because when it becomes stagnant, that's when the clots can form, and the idea is you keep the blood flowing. So anybody who's had an operation is often given these stockings, and they're prescribed them for 6 weeks afterwards. But yeah, the very nature of them is tight. Would you like to have a go? Right, I'll tell you what.
Well, I wasn't expecting that on the show. Don't do any close-ups of my feet, please.
Right, so
I will do it on there.
Right, so for example, somebody has a knee operation or a hip operation, they are prescribed these stockings for 6 weeks afterwards. Especially the elderly people find them particularly quite difficult to put them on. So I'll let you do a demonstration. So this is the sock, and this is
the normal sock that they give in the hospital.
Yeah, that's a DVT stocking. So if you just imagine that I'm like an 80-year-old lady,
and obviously you want to be very gentle.
Please be very gentle with my leg.
So I would be. That is quite hard to, oh my gosh, probably break your foot.
It's very difficult, and for a nurse, like putting these on every day, it's quite...
I would actually be quite scared to even force that on.
Yeah, no, it is really difficult. So what I did is I've developed NeoSlip. NeoSlip, because these stockings, the friction on you're fighting with friction, because they have to be high friction to put pressure on this pump to get the blood circulating. We try and have a good circulation. So I developed NeoSlip, which comes in 3 colour-coded sizes, and older person or the nurse will put this on the patient first. So this time you can try it again. You don't even have to
do that. Oh wow, look at that. Oh my God, that's such a... Wow, what a difference.
Yeah, so all the stockings are open toe, because as a nurse, you have to be able to check the toes to make sure the blood's flowing, and then you take the NeoSlip out.
That is such a simple solution. And like, after all those years of like people like basically forcing socks on, and then... This is the interesting thing. This is what I love about people like you, Naomi, because... There are people that will say, oh, you know what, this thing isn't working, and you know, there must be a better way of doing it. But then they don't sort of go away and think about a better way of doing it. But you actually went away, you thought about it, and you came up with something. Yeah. And now it's even been accepted by the NHS.
Yeah, I've got NeoSlip into some NHS hospitals, some private hospitals, some nursing homes, and NeoSlip has won 14 awards. And we sell NeoSlip internationally. We've got a distributor in Austria. And we sell also in some pharmacies, some local pharmacies. But I was a student nurse. I was studying at Kingston University, and I was given a risk assessment essay, and I just noticed a lot of older people weren't able to put their stockings on, and it kind of felt like I had to do something about it, especially one elderly couple.
It was just so simple to put on.
Yeah, it makes it a lot easier. The feedback from nurses is brilliant.
Yeah.
And
how does that make you feel, knowing that you've helped so many people?
Yeah, no, it's a really good feeling. Yeah, because I'm a mature student when I went back to university, and I've got 3 children, so I've had lots of challenges, and so we've
So you must be really, really happy about it. And what's the feedback that you've got, just before we go, from people that use the product?
The feedback is wonderful. Old people call me and say how great it is, and now they can put their stockings on, so it reduces the struggle, and nurses are asking for Neosip to be made more widely available.
Brilliant.
So that's what I'm working on at the moment.
Okay. Now, you don't have to say what it is, but do you have any other products sort of?
Oh yeah, absolutely.
I've
started. I've actually pulled the team together, so we're working on new products. So
brilliant. That's excellent. So, just before you go, any advice that you would give to someone that does have an idea for something? What the first step is?
I think the first thing to do is maybe talk about it to other people and get some independent feedback. Just get feedback from colleagues and friends, and also patients, because patients are really good at expressing what they want to nurses and telling you what they don't like. So you can actually use those ideas and come up with solutions.
Yeah. And the good thing about you, obviously, you were first of all observant. You were looking at what was going on, but you also actually spent the time to listen to people.
Yeah, I think as well, another thing, because nurses struggle to put these stockings on within the hospital environment, and there's nothing widely and easily available. Some nurses have been reported to be using carrier bags, because they've got no choice, and that's the only way they can get them onto patients, which is not really
I wanted to ask you why the different colours quickly.
Oh right, Neosip comes in 3 colour-coded sizes dependent on the patient's size. Because some patients' feet are quite large, so obviously we will need enough lubrication to slide the stocking in place.
Right, brilliant. It's so lovely talking to you. Thank you so much for enlightening us and showing us that great idea that you had. Thank you so much. Okay, so do stay tuned, because after the break I'm going to be joined by Cynthia Gregoire with her styling tips.